There aren't that many programs in psychiatric care that can be called models. Most people who have significant mental illnesses, by the statistics, by the data, should be out in the community. The idea generally is that that can't be done, or we don't know how to do it, and then hearing, well, actually it is being done over there in Madison, Wisconsin. One day there were only psychiatric hospitals with thousands and thousands of people. Gradually, another day, there is a sea change where there are many ACT programs across the country helping people stay in the community. And PACT is just instrumental in that sea change. My first taste of really understanding that was a long time ago now in the PACT program at the original house, as people know it.
Well, my name is Dylan Abraham. I was first diagnosed with a mental illness at the age of 18. I was hospitalized 5 different times. Finally ended up getting into PACT in April of 1977. And I didn't like it at first because I didn't understand it. I was used to being treated by a private doctor in the hospitals. But over time, I started progressing and got healthier and healthier. And I was staying out of the hospitals and getting community treatment from PACT. The doctor at PACT at first was Bill Knadler, best around, you know.
My name is Bill Knadler, and I'm a retired psychiatrist. Well, I started out as a psychiatric resident in the program that was the forerunner to PACT, and that actually did the research that allowed the PACT project to begin. It was called the Prevention of Institutionalization Program, or PIP, at Mendota Mental Health Institute.
A proposal was made to the central office in the Department of Health Services to close a unit here and start to work with people in the community who would otherwise be here.
The PIP project from 69 to 71 was a controlled experiment to try to demonstrate the effectiveness of the new community-based team approach to helping people live more effectively in the community. We were located at that time on the hospital grounds, and I worked for 3 people, Arnie Marks and Len Stein, who were psychiatrists, and Mary Ann Tess, a psychologist.
So I just want to start off by describing how the ACT team or PACT team did begin back in the late 60s. And at the risk of sounding non-scholarly, I want to tell you the true story of what happened, not what we write about in journals. We were working on a research unit for people with very chronic schizophrenia, people that other units had not been able to get out of the hospital, and our job was really try to develop and evaluate innovative approaches to help these clients leave the hospital and stay in the community.
It was done in the context of controlled research. There were three groups. One group was admitted into the PIP program itself, and they were then taken from Mendota. Immediately, the team would take them downtown, find them a place to stay, and then begin working with them in the community. Each of those clients were treated for 5 months.
We work really hard with our clients work really hard, they make progress, they get better, we discharge them, we link them to this aftercare service out there, and they're all coming back. So we asked the staff, well, what do you think would help? Somebody said, well, you know, when Barb Lantz, the social worker on the community, on our treatment unit, is able to go out to the community when we discharge a client and help that person, they don't seem to come back.
it was becoming clear that the period of time that we were treating people was continued to be inadequate. All of the research showed, even though we helped people for those many months, that people tended to, the two groups, the control and the experimental groups, tended to come back. Their outcomes were similar.
We said, well, what is Barb doing? Well, she would help them move into an apartment. She would help them to learn how to use the local laundromat by going with them to do their laundry. She would ride the bus with them week after week to the mental health center so they would learn how to do that. She would teach them how to shop in the local grocery store. She would even get the landlady or landlord her home phone number in case a crisis came up, and she would go out. So Barb is essentially giving the clients that she discharged side-by-side support, going out to them and helping them with whatever they needed.
People with schizophrenia and other illnesses of that severity have a long-term condition. It was clear that we had to do something that could provide extended services, and if it meant decades, it meant decades. The concept then arose of what we call the continuous treatment team. Continuous means continuous services provided by the same team, but provided in such a way that people got less as they needed it, or they were given only the kind of services that they need.
When did you see her?
I just talked to her on the phone Friday.
Because I saw her on Thursday.
I've been in the PACT program for 45 years. Eventually, with PACT support and help and hard work, I was able to make a recovery. It had been 42 years since I had been in the hospital. October of 2019, I got cancer. I mean, cancer is very debilitating, but so is mental illness. And I think the experiences of dealing with mental illness was one of the reasons why I did so well handling cancer. And I don't think I could have gotten through it without PACT's support. You know, I did a lot of national speaking and writing, and I would not have been able to do all what I've done if it weren't for the support of PACT. PACT saved my life, so now I'm on the other side and I'm doing well again.
There were times where I just couldn't handle the situation, or Dylan and I together could not handle the situation. Given my long experience now with Dylan and with the PACT program, is so important to have the kind of expertise and the kind of caring and the kind of longitudinal involvement that means you can see the team approach. You can see the team approach within the staff and the team approach vis-a-vis the client and the family.
The thing that family members like best about ACT programs is that this team is really a place where the buck stops. So if anything is going wrong, if they're unhappy about anything, they can call this team, and you have to deal with the client and that problem. You can't say, oh, I'm sorry, we're not the agency that handles that, blah, blah, blah.
Dylan had meds brought to him like twice a day, you know, that kind of thing in the early years. When we traveled a lot and were around the country giving a lot of talks, we'd have to figure that out, and PACT would adjust to that. I can't thank PACT enough, ever, for the support.
Well, in addition to just helping people stay out of the hospital and live, the relatively easy part of it was to keep people out of the hospital. The hard part was to improve functioning in employment and social skills. And so a major thrust with PACT was to develop the supported employment model, which was largely developed here in this program by Debbie Almas and Jana Fry and other people.
My name is Jana Fry, and I direct the PACT program. Supported employment is a rehabilitation construct, and we basically just adapted supported employment to people with mental illness.
That was critical so that you could help people be employed in normal community jobs.
I assisted PACT in developing their individualized vocational approach. It definitely yielded publications, and those publications reinforced the success of the approach, but more importantly, resulted in a lot of effective collaborations here in Wisconsin, and a lot of collaborations and disseminations across the United States. One of the most important aspects that it reinforced is that employment is not only an outcome of good clinical case management, which it is, but it helps people be able to improve their functioning and helps them get well through work.
When you work, you will receive feedback both from your coworkers and from your supervisors, and you will learn and you will adapt.
We produced outcomes 2 to 3 times the national average, which piqued interest not only here in Wisconsin but across the United States.
PACT and other programs like PACT have been successful in working with people on a daily basis. So PACT has sort of this national kind of prominence, but the real work is often done on a day-to-day basis by the staff who are there with some 140 or so clientele in Dane County.
Accommodations like texting him or calling him like before we're gonna come get him, stuff like that. Yeah, so we're working on bus training too. He's still a little resisting, it's just a lot of anxiety, but
There's a shot due Wednesday, FYI.
okay, thanks.
We're just gonna take the loxapine up as far as we can go. My name's Dr. John Battaglia. I am the psychiatrist here at PACT. One of the biggest ways we assist families is by involving them. You know, we do this, of course, with the patient's consent, but the family's the most important thing to work with other than the patient.
My son Tyrell has been in PACT for 23 years. And for me as a parent, it was a respite. He was 13 when he started having problems. The first time he went to the hospital, they took complete control. They just, signed him away to this medical system that was not helping him. There was a time where Tyrell actually went into foster care. When he got into PACT, it's like completely turned around. Growing in confidence, being able to go to school and get a degree, I could see the difference in the kind of care that he was getting. The wraparound, but it was more than the wraparound. Wraparound used to be, okay, there's a nurse over here and doctor over there, and somehow it's supposed to all hold together, but they're not all on the same page. Things are fractured. There were just so many times that he needed different kinds of support, and he was able to get all of that from PACT.
I think what's most unique to the PACT approach is reaching patients where they're at. And this could be physically where they're at or mentally where they're at. But we kind of come to them.
All right, it's 9:30 on a Tuesday afternoon. I am leaving the office, booking it to pick up a person for a grocery shop. Then I will drop that person off at work at 11 and pick up another person for a morning med supervision. Then I'll leave again and head to Sun Prairie to see another client. And that's it.
Our standards require that 75% of our services are delivered in the community. We are available 24 hours a day, 365 days a year. Let's listen to John Oliver.
And that's not to say there aren't programs that work. Let's look at just one, assertive community treatment. It's designed to let those with serious mental illnesses live in the community by providing regular in-home visits and help coordinating assistance in things like housing and employment. Listen to just one social worker explain how it can work.
What makes mental health might not just be a visit to your psychiatrist. It might also mean having your entitlements in place, or it might mean having your rent paid on time. So instead of meeting with a person and talking about how they're doing, how they feel, once a month or twice a month, what we do is everything that it takes to keep people in the community living independently.
That's fantastic. Everything it takes sounds like a much better option than what we've apparently been trying, which is nothing, not anything, very few things, not much, and prison.
We were involved in a variety of these PACT across America kinds of things. David LeCount invited Dylan to go with him to an international conference entitled Mental Health in the City, to be held in London, England, which occurred in 1997. I cannot emphasize enough. I mean, we barely walked into the hotel where it was being held. And when people learned that we were from Madison, Wisconsin, they wanted to know about the Madison model of delivering services with and to people with serious mental illness. And they wanted to know about PACT. Tell us about PACT.
My name is David LeCount. For 27 years, I was the adult mental health coordinator for Dane County Department of Human Services. So when PACT became more noted, many people came here from around the world. Some came specifically to see PACT and to study the model. We had many people that came here also because they wanted to see the entire system of care and how we work together and how many of the PACT approaches had been disseminated throughout our entire system.
팩트의 50주년을 축하합니다.
Having students and professionals come from other countries to PACT has big impacts. First of all, they bring cultural perspectives that improve our care.
I'm Maitol Miguelez. I'm a fourth-year psychiatry resident from Vitoria-Gasteiz in the Basque Country, Spain. And I've been doing an internship at PACT for 3 months. I mean, there are many, many learnings.
It's different. It's a different cultural perspective. And that adds to us.
I've seen here the strongest therapeutic alliances I've ever seen. I've kind of fallen in love with this model, and I will try to be the best ambassador possible of PACT and, of course, apply it in my own environment.
Yo estuve en el Program of Assertive Community Treatment. Como sabéis, es el primer equipo de tratamiento asertivo comunitario del mundo.
Working here, it's been a privilege, it's been an honor. Forgetting about the white coat, forgetting about your own role, and just focusing on treating a person, not a patient.
The aim of most participants in the PACT program is community integration. What they never say is, I want to be a better patient.
There's so much to talk about. They just do a great job. Literally, the work is, it's really the daily nitty-gritty stuff that doesn't get seen very well. Often, when I call the quiet good is the best good and counts for a lot. So that's what I really appreciate.